Hi, I'm your host, Marsha Florence for Just Ask Podcast Live. Thank you, ladies and gentlemen, for joining me today. I just want to start off with I got a lot of thank yous to do today because really last week, we'll just say our third annual Health and Fun Fair took off at the Eastern Market in Detroit, Michigan, Shed number 5, and it was fantabulous. When I say fantabulous, that means it was beyond my own wildest that I was like, you're kidding. So let me say this. We started to have the Just Ask Health and Fun Fair. The first one was in 2021. Okay, we had one in 2022, 2023. So let me tell you this. So when we started the first one, it was like, just to see if we could actually do something good in the community as far as like making sure that persons with disabilities, senior citizens, and their caregiver have an event that's tailored for them. And just so happened, it worked out. And when I say it worked out, I mean, my eyes were open like, wow, we realized that after the pandemic, that a lot of persons were not able to get out like they were before. Loved ones were stuck in the house. And, by the time your family come home, they're tired. You're upset because you didn't get a chance to have an outing of some sort. Everything was just, actually turned upside down. So we went to the Eastern Market, and that's my venue. I'm just be honest with you. That's my venue there. So hats off to the Eastern Market. I like that atmosphere because it's wide open space, wheelchair accessible, bathroom accessible, open parking. It's got all the perks that I feel fit our format for the Just As Health and Fun Fair. And we're not the average health fair because we like to have fun. All right. When I say we have fun, I included face painting, clowns, chair massage, food, music, live entertainment. Just I just want people to have a good time. You could go from table to table and talk to everybody, but when you go to that table, they are to have a theme for you, something to play, a roulette game or a card game, something to make you feel good about. Hey, I want to know what you do over here, and can I win that prize? Now, these are giveaways. These are always company giveaways, but why not have a little fun getting the giveaways, and it just makes you smile when you see how people come together. And we ask you to be casual dress. We don't want any suits and ties and high heels. Well, you can wear it if you want to, but the bottom line is, let's have fun, ladies and gentlemen. So all the time that we're trying to put things together, we try to incorporate a little bit of fun in our event. And it's worked so well that we did our third annual Health and Fun Fair event. And I have to thank, I'm gonna have to show you a video, but I have to thank so many people to help pull this off because really my co-sponsors, Bridging Communities, I couldn't have done it without them. So, hats off to Bridging Communities for always being there. The outgoing executive director, Phyllis Edwards, and the incoming executive director, Darshell Strickland Love. My hats off to you ladies. You ladies do always come to my aid, and thank you so much. But the treasurer, he sent his people. Eric Shabri's people was there. When the assessor from River Rouge, Camilla Posh, the River Rouge, and a thank you to Mayor Campbell. River Rouge sent in a busload of their residents to enjoy this event. I mean, this was a big bus. This wasn't no small bus. This was a big bus. A busload of their residents from River Rouge. Bus came from E-Course. Buses came from Franklin Wright Settlement. Buses came from Cass Methodist. And I mean, when I say buses, vans, whatever, they were there. They were there. We ran out of tables and chairs. Would you believe that? I had to order some more. So that's what I'm talking about. When you have an event that people say, you know what, our clients, our residents need to have resources or enjoy a good time themselves, they actually delivered. They brought their people in, and I'm just so, so grateful. Okay, so, so grateful. And I truly am. So I didn't want to just thank them, but the New York, Michigan Solutions Journalism was one of our co-sponsors. HAP, Back to You, Mary Freebread, Disability Network of Wayne County. I mean, people came through. You hear me? People came through, and I'm just like, my mouth was open. Like, are you kidding me? I mean, we ran out of food. We had to order some more food. Everything. When I say we ran out, but we got it back. Was on point. The excitement was there. The joy was there. My team videotaped the whole program. You know we did. Okay, so I got to definitely, like I said, show you a clip of some stuff, and then the interviews I had with my dear friend Charlie Langston. Charlie was out the country, and still I had my interviews done on Fox too. Thank you, Charlie. Thank you. Okay, and in my radio spot with Dr. Donna Harris, CHB. It just people was just like, okay, we want to hear from you, Marsha. What's going on? But I'm elated to share this with you guys through our network is because I want you to know that Just Dance is growing, and it's definitely it's time for us to have its rightful place amongst your resource information. So when we say your resource information, if you're at home, can't get around and this and that, you still can give us a call, 1-800-323-5336, and ask me a question or ask the staff a question and get the question to me. So we don't just, be on Facebook, be on all these cable stations and PBS and all that just because we had that spot. No, we're trying to educate you and give you resources that you rightfully need. And so today I took a moment out to talk about the event itself and how wonderful it was and all the supporters of the event. And I mean, I could go on with the list, but I just think I just skimmed through it. So I hope I said some nice things about all these people that I kind of wrote down here because it was true. It was true how everybody just came together. And so we had to book our spot for next year, 2024, and next year will be October 4th at the Eastern Market Shed number 5 in 2024. So that would be the fourth annual Health and Fun Fair. I'm going to continue as long as I can, and hopefully it'll grow as much in leaps and bounds. And those of you who watch the program, like I say, you always know that there's a loved one that you're caring for, or you need some care or assistance yourself, or your next door neighbor. Don't be afraid to ask, just ask. And that's what we're all about. You don't want to always feel like you're lost or don't know where to turn, or you say, God, I wish somebody helped me. You don't have to wish for somebody to help you. Make a phone call. You can give us a call. Okay, you give us a call. We'll try to find it for you. If we can't find it, we'll find out who has it. That's the purpose of Just Ask. So I always tell people, just ask. And I've learned to just ask myself. And I do want to say one more thank you to one more person, and that's St. Pat's and Satrice Coleman. They were so supportive. We had an excellent lunch. Excellent lunch. Okay, so I want to thank her as well. If I didn't put her in there, St. Pat's in downtown Detroit was just fabulous. They were so close by. The food was excellent. The timing, everything was on point. They even helped us out when we were short of tables and chairs. Okay. Thank you. Thank you. All right. So what I want to do is I just want to show you a small clip because we were actually this was right before the people started coming in, but they was coming in, so we was trying to get the clip in, catch some video footage for you so that you can know how much fun we really had. So, I see that you can see they were right up front, their table. So this was the casual part of it, ladies and gentlemen. We get set up. Okay. People getting set up and on these wonderful tables. Actually, yeah, I cannot say thank you to the Rodney Ross associates for their support as well. So definitely have to back and talk about who was that? That was American Medicare Disability Advocates. They were one of our head sponsors too. American Medicare Disability Advocates. And then we have to talk about them, okay? So we do know a lot of stuff is going around in the open enrollment period. And how do you figure out what you want to do and who do you want to see and what's missing in your package? Now, that's one thing you don't understand. If you think that you should keep your package the same, that's fine. But make sure you know what Part A, Part B, Part C, Part D is, okay? Make sure you get everything covered. So you got hospitalization, you got prescription coverage. You want to know, do you have vision? dental, hearing, okay, transportation. There's a whole bunch of stuff in your insurance packages that you don't use or you don't know. So when you talk to your agent, find out from your agent what it is that's in your package that you can utilize. And if you don't have an agent, then you have an advocate. So you got one or the other. But don't let them off the phone or out the door without finding out what it is that you're covered under. I mean, I'm a stickler for that. I'm like, well, wait a minute. So some of that stuff I never used, but I'm gonna try it one time. Okay. So if you're in the hospital, and I tell people this, you might not know it, but your doctor's supposed to be your best friend when you're sick, okay? When I say best friend, because he's setting up this operation, making sure you get, well. Well, you have this operation and you're weak, and it may be winter time, and somebody's gonna come and take you home. You got 6 stairs, you can't walk up the stairs, you're too fragile, or you're a wheelchair user. There's only you and your spouse, and how's she gonna get you in the house? You are entitled to ask for a non-emergency return home visit. Okay, a non-emergency. They call it non-emergency ambulance service. You can use ambulance, or they can put you in an Uber or cab, something where is the insurance company pays the bill, but somebody else brings you home. Okay, so if you get a non-emergency ambulance return, that means off of peak hours they will uh, come to the hospital. The ambulance techs come to the hospital, walk around your bed with the nurse, make sure everything's in place. You got your tubes, whatever it is, your medication listing. Your loved one is to be there with you. One loved one is to be there at the hospital with you. The other one is to be at the house upon discharge. Okay, so that means that if you have two people, fine. If you don't, just make sure your loved one is present. Well, what they'll do is put you back in an ambulance, no sirens, take you home on the ambulance gurney, take you in the house, and put you in your bed. Did you believe that? Okay, and it's all under your insurance coverage, but you have to ask for it 2 days before discharge. 2 days before discharge. You know you're gonna get discharged. Don't wait till the day of. 2 days for discharge. Talk to the head nurse. Let her know that you'd like to have a non-emergency return home ambulance service. Okay. So if they say no, we don't do that, you call your insurance company and find out if they're covered. Because you can get transportation home. Yeah, yeah. So I just wanted to share that with you, that there are a lot of people don't know that we don't use services because we don't know about them. And I know about this firsthand. My mom never, in about 7 to 8 years after a nurse told us what we could do, she never came home in the car again. She never came home in the car. She always came home by ambulance. Okay, so non-emergency ambulance, and my sister too. So we recognized the program, and wasn't nervous about asking them. We just asked them, we need transportation home. Can we get a non-emergency return home transportation order? Yes. Okay. So that's a little FYI. I just thought you might want to know want to know that. But I do want to thank everyone for this event here. So remember, we had our October 5th, 2023 Health and Fun Fair event. Now, I don't do too many changes on the flyers, but when you see it again next year, it's going to say October 4th, 2024, and clowns and stuff like that. Little change up in the color. You'll know what it is. That way you'll say, do I keep seeing that flyer? I like that flyer. I just like it. And I like the fact that people thought the theme was excellent, because they knew it was a little fun in there. So we took so many pictures. I gotta send so many pictures out to say thank you to people and hope that they'll come back and see us again. And we're gonna have something else probably midsummer. We always try to have planned something to keep our names out there and keep you interested in wanting to see us and what we do. So, okay, well, now enough of that. So, I did want to go back and recap on one of the previous shows that I did, which was the Urban Aging News, the many faces of caregivers. Now, the reason I'm bringing this up, ladies and gentlemen, is because there's a couple of pages in here that I definitely wanted you to consider reviewing if you have the Urban Aging News. And if you have it, you may want to order it and contact them by their website down below, urbanagingnews.com, and speak to the publisher herself, Pat Rencher. So now Pat has some very interesting people in this paper. So I went through the paper again, and I came up with some things that I want you to check into. So the Michigan Medicare and Medicaid assistance program. I think that's a good time for you to take a look at this number down below. And it says, what do I need to consider when selecting or enrolling with a Medicare provider. So, it's that time of the year. You want to get this information out, and you want to be able to sure that you got the right policy programs in your policy, because you can choose something and not know that you're never going to use it. Now, I know for me, for a fact, I'm going to ask for services for hearing. I'm hearing impaired and have been ever since I was a child. So yes, I do wear hearing aids in certain areas like conferences and stuff like that. But I'm one on one. I can hear pretty good, okay? But I do have a deficit. I'm not gonna say I don't. Now I'm gonna be looking for hearing coverage, okay? So somebody else who wear glasses was looking for eye coverage. Well, I'm looking for both now, okay? Because you're aging, you're looking for a couple of things. So don't discard hearing just because you say, well, there's nothing wrong with my ears. You can get your ears clean, okay? If your hearing is getting low, don't equate that with a loss. Equate it with the fact that you probably need to get your ears checked to make sure that either you're experiencing loss or that your ears need to be clean. And a lot of people don't think that's important because they never had their ears cleaned before. But a cleaning doesn't mean they're going to hurt you or anything. Don't hurt it all. I'm gonna tell you what I know because I have to get my ears clean every 3 months. And when I say clean, my doctor is he's so kind. Okay, I go to the Michigan Ear Institute, and the doctors in there, they got my chart. I've been a patient for over 15 years, and so they know who I am. They know when I'm coming, what I'm gonna get. Nothing bothers me, nothing hurts. I get checked out, make sure everything is okay. If there is any issue, I get topical cream or something. But ladies and gentlemen, let's put our ears in our package of care, because those of you who wear hearing aids, good if you really need them, but also don't just go to the store or order something offline and say, well, I'm going to use this right now, and never did get your ears checked or clean. You know, that's my neighbor. But anyhow, so I just want you to take a look into that, okay? Now, the other page, prepare now in case of a power outage. This was by the New York Michigan Solutions Journalism Collaborative. The executive director Monica Williams had wrote this article, okay, and in effect that she was saying something about how do you prepare for when there's a power outage? What do you do for your loved ones who are frail, and you need to know where you're going to take them, what you're going to do, stuff like that, because you don't know. Do you have a plan? Do you have a package ready for them in case you have to transport them somewhere else? Now, I experienced this myself. My sister had a COPD, which is chronic pulmonary disease, and she was on oxygen 24/7. So, we had to have a plan. And it was hard. I'm not going to tell you it was easy, because it wasn't. It was very hard. The fact that I'm saying it was hard is that you don't know when the power is going to go out. You got to have things ready in place of. So it's just like when a woman is expecting a baby. If she has a overnight bag ready to go to the hospital with her, you must have an overnight bag ready for your loved one who's frail. If you have a person like my sister who's on oxygen, maybe they're mobile and maybe they're not. Well, if they're not mobile, what's the plan? Who's going to come and get you, or get both of you? Or, do you have a place nearby that you can, get transported to? Do you have money set aside for emergency cab or Uber or something? We don't plan. We don't plan. And so while our loved ones who are frail and ill, they're at stake because we don't have a plan. So she wrote that article, and I hope that you all will go back and if you have the Urban Age News, fine. If you don't, just know that you need to schedule a plan. So she's got down here battery power radio and extra battery, cell phone, car charger in case power fail, first aid kit, flashlight with extra wide beam and high power bulbs. Those are some of the simple things. Blanket, sleeping bag, and pillow. Those are some of the simple things. So I want you to consider, if we're going into our coldest months now, that things do happen. Try to be more prepared. Try to get stuff together the way you think will help your loved one. All right. So on that one. Now, I think I left a piece off of the National Caregiver Support Portal, but what I can say about the portal is this: letting you know that if there is a service that you're looking for, or you're trying to arrange for yourself to be able to be mobile and get out and do some things while your loved one is being cared for, or you need some resources, there is the Caregiver Support Service. Okay, so that's DAAA's information. Okay, so DAAA is giving you that information if you need to. That's Detroit Area Agency on Aging. Okay, you see that nice number down there, 313-446-4444, 313-446-4444. And they do have a person's website, okay, which is support services at what was it, White CR at DAAA1A.org. So that person, they said learn more at the www.daa1a dot what was that, truetell.com. Okay, so I read that wrong. Got new glasses and still can't read. All right, so those are those people's names down there, but call the number, ladies and gentlemen. Find out what you need to know in reference to a caregiver support portal. All right, from there, now this is the page I was trying to catch. I wanted you all to see where they talk about the Michigan. It's a lot of good services on here. Okay, and you know what? Better Health. Corktown Health was at our event. Thank you, Corktown. Thank you for coming out to see us. But let me tell you this: the one I was trying to get you to recognize on this page was the driving. Michigan's Guide for Aging Drivers and Their Families. Okay, let me say this: you try to take those keys from your dad and your mom, it's not going to happen that way. So this reads: Michigan Guide for Aging Drivers and Their Families offer helpful tips on observing older adults and their driving abilities for signs and symptoms indicating driving problems. There's also a list of driving rehabilitation programs and specialists who can determine if a visual, physical, or mental condition is affecting the ability to drive safely. If an unaddressable problem is determined, the guide recommends submitting a driver education form, DA88. That's D as in Dana, A as in Apple, the number 88, requesting a re-examination of the unsafe driver to the Secretary of State either online or by written letter. Warning, while it is not while it will not be disclosed to the driver, the form requires an explanation of why the driver is deemed to be unsafe and the full name, address, telephone number, and signature of the person filing the form. Now, let me say this because you're about to get yourself in trouble. So, mom and dad don't want you to take their license. You can get that guide. At least get the guide. I would say that, and go through the guide and see if the guide was helpful for you. But in the interim that you're trying to say to your loved one, it's time for you to stop driving. As my father told me, well, who gonna step in and do what we need to do? Who gonna take us to the doctor? Who gonna get our groceries for us? Who gonna take us to the hospital? He had so many things on the list that I was like, oh my, okay. So I'm not saying that it's right to allow a person of a certain age to keep driving, but you as a family member, go riding with them, talk to them as you're riding with them and ask questions and check out their availability, their abilities to drive, okay? Ask questions so you can determine by watching your loved one. You don't have to say, well, he looks like he's too old. No, get in the car. Get in the car. And I told my father, I said, take me to the store. My father took me to the store. I didn't see anything. And I'm not talking about take me to the corner store. We were in Alabama where he lives. And that was a long ride to the store. And I'm like, I don't see nothing going on here. So my brother said, well, still need to take the keys because he could hurt someone. So let me tell you this. So it goes both ways. Someone young can hurt him, so he can hurt somebody young. It doesn't matter. An accident is an accident, true enough. But when you're going to take your loved one's keys, learn how to do it with diplomacy. Don't just jump up and take those keys and just tell them, well, you can't drive anymore. You have to have plan B, A, B, and C in place if you're going to start to take or remove the keys from your family members because you feel that they're at risk. All right. So that's just a FYI. You just don't jump up and take them keys and think, they just got to stay there till I get there. They wasn't staying there in the first place, but now you're really trying to make them stay there. So we do know people have dementia and they're still trying to drive. Sure, I understand. Take the keys, but do it in a way that's fashionable that it doesn't look like it hurts them. Okay. And I'm gonna tell you something. My stepmom had dementia and it was really bad. And the keys, she always kept asking for her car keys. Finally, I had to give her. My brother and I put some dummy keys out, keys that didn't work. And when she went to the car and she realized the car wouldn't start, and she stopped. You got to be kind of, inventive. All right. So some of us are, some of us aren't. There's some legal information you might need. Durable financial power of attorney, durable health care power of attorneys, last will and testament, living will. Now, all these things are important, so don't overlook them. Definitely, you want to check those out if you think that it's time to get your papers in order, ladies and gentlemen. And my dear friends down here from Hannon Center, respite care. Now, I really want to talk about respite care, which for those of you who are having a little difficult time having a day off to yourself, a few hours, things like that, you may want to check Hannon Center out to find out about their daybreak program, Hannah Daybreak program, located in Midtown. Allow caregivers time to work, run errands, or rest a while the loved one has the benefit of socializing and recreational activities. So that's true. So they have not face paint. They have art. They have lunch. They have exercise. It's a nice program, and the facility is just gorgeous, and it's safe. So you might want to check out Vincent Tilford of Hannon Center. That number is 313-833-1300, extension 24. All right.
You're there for them. We're here for you. Find free care guides at aarp.org/caregiving.
So I just really wanted to I was so excited about the Just Ask Health and Fun Fair that I had to kind of put something else in there too, because truly I could have did a whole show on the Health and Fun Fair, and you guys were like, "Is this a show about all that?" It really would have been that way. Could have been that way. So we're back in the studio. Look for our upcoming shows. You're going to be surprised what you'll see. Got some very resourceful information coming your way. Like I said, if you always have a question for us, you just email me, Marsha at Just Ask Talk Show, or, go to the Facebook page and drop me a question. Or, they don't call it Twitter no more. X. I'll get that fixed. I don't know what that is. I'll get that fixed. But anyhow, it's that time today, ladies and gentlemen. I have to run, and I want to thank you so much for spending this afternoon with me. I'm back on track now. The event is over with. We're back on track. I'm your host, Marsha Florence for Just Dance. And what do I always say? If you had a question about a person with a disability, or if you just have a general question, don't be afraid to ask, just ask. And once again, I thank you for your time and effort for spending the day with me, and we'll see you next time. See you next time.